So you've just been told you have thoracic outlet syndrome, and now you want to get on top of your injury and fix it for good. In this video, we're going to give you a full understanding of what thoracic outlet syndrome is, and then how to fix your thoracic outlet syndrome permanently. First of all, what is thoracic outlet syndrome? Thoracic outlet syndrome is an entrapment of either your nerves or your arteries that go through your shoulder. The most common one we see here in the clinic is an entrapment of the brachial plexus as it passes from the neck into the shoulder through these muscles just here. How do you know which one you've got? Well, we're going to go through some tests to show you whether you have an arterial thoracic outlet syndrome or a nerve thoracic outlet syndrome. But first of all, how does this injury occur? Most commonly, you get it from sitting at the desk for too long in that sort of forward shoulder position. So when you're in that forward shoulder position, what happens is there's certain muscles that become really tight and contracted, and the nerves and the arteries pass around these muscles. So if they're tight and contracted, it actually compresses these vessels and will then affect their flow down the arm. The muscles that are impacted in that forward posture position are your pec major and your pec minor, your scalenes, and your subclavius. Other ways you can get this injury is from repeated trauma or a one-off really forceful trauma. Now I see this in our CrossFit athletes when you're doing a clean and jerk and you have to re-rack that bar. Sometimes if you don't catch it correctly, it impacts and pushes down on your collarbones or sort of your shoulder and just depressing everything down. Now that usually one here and there doesn't matter, but if you repeatedly have bad technique with that and it irritates those structures, they'll start to inflame, develop adhesions, and then almost constrict the vessels and the nerves as a result of that. It's really important to understand your injury and what type of injury your thoracic outlet syndrome is. So with this, I want to give you a couple of tests that you can use to diagnose whether you have the arterial restriction or the nerve restriction. So the arterial test is called Allen's test. Now for this one, all you're going to do, pop your arm up in this position, and then you're going to open and close your hand 30 times. Now, if there's a restriction through here and you're demanding more blood flow up the arm with the opening and closing, you'll start to feel a tingling or a reproduction of your symptoms into your hand and forearm. If you don't get symptoms with Allen's test, then you want to go on to the next test, which is called Addison's test. Now this is going to test, like I said, the nerves. So for this one, you're going to take your arm back behind you, keeping it straight, turn your head to the left, and then side bend a little bit like that as well. And then just hold that position. And you'll find over about 20-30 seconds, you'll reproduce those symptoms down the arm. Now that you are able to recreate your symptoms, you've got a better understanding now of what your thoracic outlet syndrome is and what's causing it. Is it the nerves or is it the artery? Regardless of what it is, you're going to need to treat all those structures through the shoulder to relieve the symptoms, whether it's the pressure of the blood flow or the nervous system. So to treat this injury, what we need to do is address 4 factors. The first thing we're going to address is the nervous system and actually doing stretches for the nerves. And this is going to help desensitize those nerves so that they don't produce symptoms so easily. The second thing we're going to work on are the muscles themselves, and we want to make sure we're doing the exact stretches and exercises to change those structures around the shoulder and be really specific with which muscles we're targeting. The third thing we're going to address is the thoracic mobility or your mid-back sort of flexibility. A lot of people who develop thoracic outlet syndrome, like I said, are in that forward shoulder posture, and we want to work on the spine a little bit to straighten that up a little bit. And finally, once we address all those soft tissues and get the spine mobilized, then we're going to work on strengthening the back muscles and making sure it holds it all back in place to take pressure off all the front of the shoulder there. Okay, now it's time to actually fix your injury. And like I said, the first thing we're going to work on is the nervous system. So there are 2 stretches or mobilizations that I want to do for this, and they're going to be targeting both the median nerve and the ulnar nerve. So to work on the median nerve, what we're going to do, arm out here, straight, make sure that elbow's locked out, wrist extended, and then side bending the head away. And then as you come back, the wrist flex and the head goes back towards the shoulder. And then you're just going to go back and forth like that. So that's pulling the nerve sort of back and forth, and what it'll do is it'll sort of move it through those entrapped muscles up here in the shoulder, and you'll feel some pulling, and it might even stir up some of your symptoms, but eventually it'll sort of wiggle it free from where it's stuck up in here. So that's one of the nerves. Now the next nerve is the ulnar nerve. So to do this, really simple. OK sign like this, you're going to come up and bring that to your eye. So it's just going back and forth like that. It might feel a little bit unco at first and it kind of looks stupid, but it's really, really effective for the nerve that sort of runs more through the lower part of the shoulder there. So the next muscle that we're going to target is the pec minor muscle. Now I would say this is the biggest player in thoracic outlet syndrome and the one most overlooked by therapists treating the area to try to restore this injury. So to do this, we'll have a squat rack set up like this where the barbell's across and you've got it on the opposite side because we're going to be pulling on it and we don't want it falling off the rack. If you don't have access to a squat rack, you can also use the kitchen sink for this one. But I prefer this because I think you can get better leverage. So with this, holding on the barbell like so, pin the shoulder blades back and down and really squeeze them. Then you're going to lunge forward and sort of lower down so your knee comes to the ground. And that's your stretch there, making sure those scaps are sort of really squeezed back. Hold this for about 30 seconds at a time. Ideally, we'd do this 3 times. Another stretch for the pec minor, because it's so important to fix, is going to be using a band. So I have this red band attached to the squat rack here. You're going to grab onto it, step forward. So we've got that pulling the shoulder back. What you're going to do here, keep sort of pushing forward with that arm, but twist your body away and let that shoulder fall back. Now I want to keep my ribs down. I'm not going to arch up like that. So hold that all down nice and tight. And then you can just keep twisting around. You can even let the shoulder externally rotate a little bit and just holding it down. You'll get a big stretch through this region. Just like we did for the other one, 30 seconds at a time for this. Now, if you're enjoying these stretches so far, make sure you smash that subscribe button and give me a like because this will help me make more videos for you guys in the future. So the next one we're going to look at is the scalenes, and this muscle is just down at the bottom and side of the neck, another big player in thoracic outlet syndrome. A lot easier to stretch and you can do this anywhere throughout the day. What you're going to do, side bend the head just straight across and then lower the shoulder down. Hang out here, again like all the stretches I recommend, we're just going to hang here for 30 seconds. Okay, now we've addressed the soft tissues around the front of the shoulder there to take all the pressure off the nerves. What we need to do is address your posture of the spine and make sure you can come up in that upright position. We call this thoracic extension mobility. We're going to do this just with a foam roller, laying down across it like this. We'll start simple, just rolling up and down. We'll go for about 10 passes. Once you find that sweet spot where it's a little bit stuck, you can hang out there, reaching up and overhead. Move through a few of these passes. You can even see what rotation's like, moving back and forth. Play around with these positions. You'll find that it's really stuck and you'll know for you what needs to move because it'll be quite sore. Now that we've addressed the major muscles through the shoulders that will act on thoracic outlet syndrome and we've changed the mobility of the thoracic spine, it's time to strengthen the muscles that will hold your posture in the right position to stop that internally rotated position of the shoulders, which jams up all those nerves and vessels. So for this, first we're going to start with the deep neck flexors. And you might have seen people doing this or been given a really basic rehab exercise of this. What this is the deep neck flexors are like the core of your neck and it will stabilize how this all moves together. Really simple. I'm going to show you from side on here. Starting from here, making a double chin, just like that. Now the mistake people make with this is when they come back, they extend. So you want to make sure you scoop your chin in like that, not that. Okay, 3 sets of 10 for this one. Really important not to be lazy here. Okay, so the final exercise that I want to show you guys is for the middle trapezius muscle. So this is in between your shoulder blades. So to do this, we're going to get a thin band, thumbs out. That's really important because if we go thumbs in, we're going to target the rhomboids, thumbs out, middle trapezius. Holding like this, starting at a level of just at the top of your sternum, pulling that so that it hits the bottom of the sternum. So there's a little bit of lowering as you come across. And you're just going to go back through those reps, 3 lots of 10, squeezing the shoulder blades back and down as you do that. All right, guys, that should get you through your injury of thoracic outlet syndrome. Let me know how you've gone with these exercises and if it's helped you, or if it hasn't and you need some more tips and advice, feel free to comment below. Now, if you've enjoyed all these exercises, make sure you hit that subscribe button, because again, like I said, this one really helps me grow my channel and give you guys more quality videos on how to fix your injuries.